Hello everyone, I'm Dr. Rogin Subedi. I'm an interventional cardiologist at Southern Mississippi Heart Center in Ocean Spring. Today, I'm going to talk to you about the impact of e-cigarettes and vaping in the cardiopulmonary health. E-cigarettes are known by many different names: e-cigs, e-hookah, vaping pens, tank system, or electronic nicotine delivery system, commonly abbreviated as ENDS. In this system, the heating coil that is present in the device vaporizes the fluid into the aerosol, which is then inhaled by the user into the lung. It contains propylene glycol, glycerol, nicotine, and different flavorants like mint, menthol, or different fluid flavors. This device can also be used to deliver tetrahydrocannabinol, which is also known as marijuana, or different drugs. Bystander can also inhale when the user exhales the aerosol into the air. While the FDA initially tried to stop this device from coming into the market, stating that this was a drug delivery device, after years of litigation from the company, the FDA finally lost in 2010. And since then, the use of e-cigarettes and vaping products has exponentially risen, mainly in the youth, high school, and middle school students. Among high school students, the use of e-cigarettes and vaping products has increased from 1% in 2011 to 10 to 20% at present. Among middle school students, the incidence has increased from 1% to 4.9% in 2018. In 2021, 4.5% of all US adults use vaping and e-cigarettes. So what are the health effects of e-cigarettes or vaping products? E-cigarettes and vaping products are fairly new in the market, and we're still yet to learn about the long-term health impact of e-cigarettes and vaping products. Most of the e-cigarettes or vaping products contain nicotine, which are also present in cigarettes, and they are highly addictive. Nicotine binds to the nicotine receptor and has a sympathomimetic effect, causing increased workload to the heart and increased blood pressure, which over time cause cardiac remodeling, heart failure, and fatal cardiac arrhythmias. Nicotine can harm brain development in the youth, and it can also impact their learning, memory, attention, and impulse control. Then there is propylene glycol and glycerol in the device that has direct cardiopulmonary effects and can cause throat irritation, dry cough, and wheezing. Then there is a flavorant which, when aerosolized, generates reactive aldehydes, which can cause DNA damage, heart damage, COPD, and lung cancer. Heavy metals like nickel and chromium, which are released from the heating elements, can be inhaled and cause lung damage. Vaping is associated with a new clinical entity called EVALI, or e-cigarettes and vaping associated lung injury. And through 2020, there has been more than 2,800 hospitalizations, and more than half of this requiring ICU admission from EVALI. And there has been more than 68 deaths reported from EVALI itself. Therefore, people who vape have an increased risk of cardiopulmonary disease. They are also susceptible to more infection because of suppression of our immune and inflammatory system. And these are all the short-term effects of e-cigarettes and vaping, and we are yet to know the long-term effect of this. Until then, the animal models serves as the best surrogates for the long-term effect. Animal models suggest that the use of e-cigarettes and vaping product is associated with increased oxidative stress, DNA damage, increased risk of COPD, and lung cancer. It is also important to note that the physiological effect of e-cigarettes and vaping are very similar to what was seen in the earlier stage of cigarette smoking. So in summary, e-cigarettes and vaping is not benign. Adverse effects tend to accumulate and tend to be worse over time. Nicotine present in most of the vaping or e-cigarettes is highly addictive and increases the risk of future addiction to other drugs, especially in youth and children. Most of the e-cigarettes and vaping, which they claim are nicotine-free, are not. It also contains cancer-causing chemicals, volatile organic compounds, and heavy metal like nickel, chromium, and lead, which can be carcinogenic. So, talk to your children, your student, and your loved one about the health risk of vaping and electronic cigarette. Support and encourage them to quit. Let's empower our loved one, children, and grandchildren to live a life free of vaping.